Hi everyone, this is Dr. Mak with another video today, and we are talking about why you should not get crowns on your teeth. I had this short video that I posted on my YouTube and Instagram, and so many questions out there, people asking us this happened and that happened, and then they got crowns with this experience. Should we get crowns? Should we not get veneers? What's the difference? So I thought, why not do a full video on this topic so people have more information and they can have a bit more relevance on this topic when they're looking to get their teeth done. Now, first thing you need to understand is when we talk about crowns, we are looking at covering the full surface of the tooth. That means if you have 4 walls, you're covering all the walls and you're putting a cap on top to cover and support the tooth. Now, this concept has been happening from a long time, but dentistry has come a long way now. And these days, what we prefer is to do minimal invasive options. That means we don't want to grind the teeth off like crazy. If you can save the tooth structure, we would like to do that. Now, there are 2 things when we say we want to save the tooth structure. One is, do we have virgin teeth? By meaning that, do you have previously filled teeth, or do you have previously definitive restorations already done? Do you have previous fillings done? Do you have cracks in the teeth? Do you have holes in the teeth or not? Because if this is the case, then minimal invasive dentistry might not be the best option for you because your teeth are already quite heavily damaged and they need some support. But if someone are young clients and they have less dentistry done on them or no dentistry done on them, to change the color, shape, texture on the teeth and give them a beautiful smile, you don't need to necessarily grind the teeth off like crazy. And that's time we say, please do not get crowns. Let's work with the minimal invasive concepts in dentistry, which are veneers. Now, a lot of people don't know and make a separate video on this topic. There are different kind of veneers. It's not just one veneer, like we say crown and then the whole thing covers. There are different types of veneers and it depends on case by case cases. So every smile is different and we need to support the smile in the best way possible. And the reason why we do this and we say this is because we want to do a minimal invasive option, but at the same time, we want to do something which is long term. Because minimal invasive doesn't mean that you're going to the dentist every 2 weeks and you've chipped a tooth. Ideally, when we do the smile makeovers, depends on person to person, they should give you 10, 15 plus years if you've done by the right person. And that's why it's so essential to pick the right dentist who's following those concepts, but at the same time, he's not compromising a lot of tooth structure. So why is it a problem if someone shaves their teeth too much, if they drill too much? Why is it a problem? The problem is you have to understand the anatomy of the teeth. There are different layers of the teeth. So you have the outer shell, which is the enamel, the thick white. Then you have the inner, the dentine. Then you have the inner layer, which is the nerve or the pulp inside the tooth. The problem is once the outer shell, the enamel, which is a protective coating of the tooth, disappears or has been damaged, now your teeth is more prone to decay, damage, and all those problems. That means long term, you're looking at sensitivity in the tooth, looking at prone to decay in the tooth. Even if you have a cap on top, it can leach. At the same time, you are more prone to get root canals and other painful problems in the tooth that needs extra treatment. Another reason why we don't want to shave too much is the outer shell, which is the enamel, is very thick material. That means if you are attaching a veneer onto the outer shell, it has studies have shown this is a very long-term success in it rather than the inner porous layer, which is not as strong. That's another thing why we want it to be minimal invasive. So we want to attach it to the outside shell of the teeth to give you a long lasting result. And we have studied that shown 20, 25 years amazing clinical success with veneers if done the right way and attached to it, the enamel. So when we say don't get crowns on your teeth, that means don't get aggressive treatment done when you have minimal invasive options available. Now, unfortunately, not a lot of dentists still practice this. Crowns, they've been happening from the longest, 50 plus years, so everyone knows how to do crowns. When we talk about minimal invasive dentistry, minimally prep or no preparation veneers in which you're not drilling the tooth at all. And when I post my cases on Instagram, people are amazed that you have not drilled at all. This techniques or this foundation of clinical knowledge, not everyone has, so you're struggling to find the right dentist. However, it's important for you when you're doing an investment on your smile to discuss this with your patient, not with your patient, with your dentist and the provider of your treatment, that how much tooth structure they're going to remove, how much they're going to drill, what are the impacts you're going to have on your teeth long term. And that's why it's so important to don't get your teeth shaved like crazy. Have the minimal invasive concepts. Because as patients, as our clients, they want a nicer, brighter smile. As your provider or your dentist, we want to do the minimal invasive options. So we have protected the teeth in a way that is long-term prognosis on your teeth. We want to mix these two. So you get great results and we have secured the tooth structure. You're not having those ongoing problems. Now, if I combine the two, you're getting the final result. So that's the main issue, that if you can get those amazing results without having those teeth shaved down like crazy, why not? So when we say don't get crowns on your teeth, that means if you have a minimal invasive option, we'll do that. Again, it really depends on if your teeth were previously damaged, if you had previous crowns, if you had previous fillings, if you have worn down teeth, if you have big wear in the teeth, you had erosion in your teeth that had completely destroyed the outer shell or the inner shell of the teeth. What is the current condition? Based on that, we want to do a long-term treatment. Now, for someone who has deep cracks and damage, crown may be the only option, but considering that this is a last resort. It's not the first option, but that's the best option for people who have heavily damaged teeth. But these days we get clients who want cosmetic corrections. They want to change the color, shape, and contours of the teeth. They have virgin teeth 90% of the time or 80% of the time that we see in our office. You don't need shaving of the teeth to get veneers. You can have a beautiful result just by having minimally prep or no prep, based on the case, based on the smile, based on the final outcome you're trying to achieve. When we go to your dentist, whoever you go to, some of the good dentists out there should show you a digital simulation or can do a hand mock-up on your teeth or a lab designed mock-up on the teeth, showing you what a final result can look like. So whenever you go for a smile change, ask your dentist, can you show me what the final result can look like? Either digitally or on the teeth physically done, so you can have a final result already in your mind. So you're planning in advance what the final result may look like. Based on that, you can always talk about changing the color. This is what I don't like. This is what I don't, want to get done, and you get a very good result. So choose your dentist wisely, and if you can avoid getting crowns. Hope this is helpful. If you like the video, share it with someone who can benefit out of it. Like and share our channel and do subscribe. And if you want to see our before and after cases, I shared on my Instagram channel, Dr. Murtaza Mak. I will share the link on the bottom of the video. So hope you enjoy the smile makeovers and hope you smile more and hope you find the right dentist for your smile. God bless you, everyone.